This is a story about courage. Not ordinary courage, but the exceptional courage that children with cancer and their parents have when they have to return to hospital again and again to have medical procedures, many of which are painful, a part of modern cancer treatment. This is also a story about some psychological techniques that make the difference between coping and not coping. These psychological methods allow children to help themselves through anxiety, uncertainty, and pain, so that they feel a sense of control and accomplishment.
And you know what? That worked perfect.
Oh, and she got lots of strength from Mummy because she held on lots tighter.
She did.
Look, I'm almost going blue. My fingers are almost going blue.
I know that. So just get out of it.
Start moving again.
1, 2, 3. Done. There.
I thought you're not leaving someone in for Christine.
I gave her Christine.
Already?
I don't want any tape on.
I didn't realize.
I don't want any tape on.
Okay. How about a Band-Aid? Nothing?
She just
likes it on. Okay.
Oh, that's superb.
I'll have to squeeze it for a little bit longer then.
This distraction works great. Mum doesn't know what's going on.
Going down.
Here we go. I see it. I see that big smile. Oh, you close your mouth and get it on your teeth.
It's Halloween at the Cancer Outpatient Clinic in Children's Hospital in Vancouver. And as on every other day in the year, children are here for another round of medical procedures. On this day, a fairy princess, Heidi, has come to hospital to endure another intravenous poke.
Squeeze. That's a good squeeze. Blow, 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 blow.
Blow, Heidi. Good girl.
Squeeze my
There was a time when a 4-year-old child would be expected to cry when having an IV. This is no longer the case. Through the research that we've done, we've found that simple methods such as blowing bubbles, breathing, the distraction techniques, as well as the more sophisticated methods such as the hypnotic techniques, imaginary involvement, hypnoanalgesia of the hand, the magic glove, can be remarkably effective in reducing a child's pain and anxiety, and can be readily taught to children and their best ally, their parents.
If I've got 10 to 15 minutes to talk to Heidi first, or even 20, and I'll prepare her, and finally we'll tell a story. We'll play with a little cubby bear, and we'll give the bear the needles, like the little tourniquet that goes around the arm, and we practice that on a bear, and the relaxing the 5 steps and so on.
Great.
But if we know it's coming, we can get her ready. But if they just come through the door and they say, poke time, the kid goes nuts. This whole process of chemotherapy and being hospitalized for cancer is just one of a long line of needles, blood tests. It's a horrendous experience for them, and it's very difficult on the parents. There's strength in being in a room where there are other patients because the parents give support to one another. And having seen what they went through and some of their explanations gave me a chance to start trying to find a flight plan to help Heidi through all this.
But for a newly diagnosed child like Kelsey, the anger or terror of anticipating pain is so overwhelming that all the distraction with bubble blowing just will not work.
We know this will not last. By being persistent, truthful, and encouraging Kelsey to blow away her fear, children like her learn to resist less and cope more, particularly when mom or dad participates in the challenge.
Okay, Kelsey, the water's coming.
Oh, you're such a brave girl. You have to stay really still, and then it will be over in a
I'm not going to
minute.
hold you quite so tightly, okay? Is that better like that?
If you don't move, then they don't have to hold so tight, okay? Oh, you're doing well. Oh, yeah. Stay still.
Just a little bit longer, Kelsey, and then we go out and see that.
There's no more.
I almost feel guilty at this point, seeing what a difference it made today that I haven't done it before. The reason at first that I didn't want to go in was because I didn't want to be a bad guy, and I didn't want to feel like I was kind of responsible for keeping her in control when I didn't know if I could stay in control. But now I think just, you know, feeling better about it and knowing that I'm not responsible, that you are there, that, you know, if things are out of control, that somebody else can kind of step in. I don't have all the responsibility on me. At first I would get so mad about it that I would go through with it, but I didn't try and make it easier. I don't know how to say that. But now I can kind of get past the point of all these things being done to my child, you know, and get past that and try and make it easier for her.
There they go. One more. You did it. More.
The bubbles are beginning to work for Kelsey and her mum.
If we can make this ghost appear, there he is. Sometimes he's reluctant to come out.
Another powerful distraction technique, particularly used for school-aged children, is the use of pop-up books.
Coming out of the wall there, or is he just sitting on top?
12-year-old Michael becomes fully absorbed in the exploration and surprises of the haunted house.
Can you imagine putting a cake in the oven with candles on it? Hey? Well, probably not. Yeah, I think so. It's in the fridge. Well, this poor old fridge has had seen better days.
Parents are an integral part of our treatment program.
Cancer treatment in children in the last 15 years has resulted in really long-term cures, 10 years or more, in 60 to 70% of cases. But that cure has been at the price of a very prolonged period of treatment, the administration of unpleasant drugs and unpleasant painful procedures, which can go on from anything from 1 to 2 or even 3 years. So that the giving of this treatment has become a major problem in therapy. Sedatives in children don't always work as well as they do in adults. In fact, a child can often become excited rather than sedated. And they are very difficult to gauge. If you get a child sleepy enough that he doesn't feel painful prick, he may in actual fact be in danger. Some areas, for these reasons, use general anesthetics, but they all therefore incur a certain risk. And in our area, we've therefore looked at the use of good local anesthetic plus the psychological techniques that we're going to talk about.
Craig, Shauna's dad, showed an eagerness to be able to help his daughter whenever she's in pain.
I can always tell when you're doing a good breath because I hear it whistle past your lips. And I know you're controlling it.
First, we use the breathing technique.
The more you think about your breath,
Yeah.
the less you think about other things that are happening, eh?
Yeah.
And you can concentrate just on the breathing and feel the fear just blow right away. If we get a little bit nervous and worried, we can always do this just to relax ourselves. We don't have to be in pain, do we?
No.
Or if we get upset or something.
In the beginning, it wasn't, we didn't have the breathing. And to see Shauna go through a lot of pain and lose her control, she would just be drugged up to stop the pain. But once the pain started, she'd come out of the drug-induced stupor, I guess you would say, and panic. And it just tore me apart to see this. And until I was introduced to the breathing by you, I had forgotten about it because I had done a breathing, a prenatal with Shauna, breathing pain control. And I don't know, it was because the introduction of the shock of her having leukemia and so on, I didn't think of using that technique. So when finally that you showed Shauna, and you know, we tried it over a few times. Shauna, I was just amazed the way she took took on this breathing. And once she saw that she could stay in control during a painful procedure, there just was no turning back. We got to a point, no matter how much pain there was, she'd always come back to the breathing. In the beginning, you know, she would still lose it, but eventually the breathing got stronger and stronger in the rhythm and the results, that it came natural to her, and just a little reminder. But without it, you know, there's just a shocking difference.
When I do my blowing, it, like if they're giving me a poke or something, I don't really think about I'm having a poke. I just concentrate on doing my blowing, and that way I don't even really think about what's happening to me. Like if they give me a poke, the pain, sometimes it changes, but sometimes it doesn't. But most of the time it changes, and I don't even know that there's a needle in my arm or something. I just don't even think about it. It's funny how it works. It really does.
And later, they learnt the hypnotic technique, imaginary involvement, or mind imagery, as Craig likes to call it.
Do you want to try? Do you want to see if we can go on a little trip? Can you imagine that you're in a nice, warm place somewhere? Think of a favorite place you'd like to be. Can you imagine where you'd like to be?
Yeah.
Maybe a nice summer day somewhere?
Yeah.
So for that kind of pain, which was longer term and just something she had to stay with and wouldn't go away, the mind imagery would work like magic.
What will we see in Candyland?
There's some people.
Some people?
Some candy sticks.
With candy sticks?
Yeah.
Or they look like candy sticks?
No, with candy sticks.
Uh-huh.
And the houses are made out of jelly beans.
Like, she relies on me. We are a team. And without that, she just gets a little panicky. She thinks that she's having a procedure. She says, "Daddy, you're going to be there, right?" And that bond will grow. You know, as she grows, it'll grow too. And it'll always be there.
When I go away on trips like that, it's like the blowing again. I'm concentrating on that, and I just forget about tummy pains or leg pains or feet pains or anything like that. I just forget all about it.
Hypnosis is one of the most exciting and effective of the psychological techniques to reduce the sensation of pain and anxiety, even though hypnosis will rarely remove pain entirely. Hypnosis occurs when a child's attention is focused, narrowed, and absorbed. Children can enter this altered state of consciousness far more easily than adults, as children have blurred boundaries between fantasy and reality. Brian, the really important thing is to watch, and you're going to be so surprised to see what happens to that sensation. Is it going to just become a tingle and disappear, or is it just going to not bother you? You'll feel something but not bother you. There'll be all kinds of changes, so that when you use your imagination, watch really carefully and see what happens to the sensation, because it does change.
Does Paul get thrilled by imagination?
Do I get what, thrilled?
Yeah.
I imagine I get thrilled by anything, Brian.
Oh, after yesterday, we know you get thrilled by imagination.
That's right. You need imagination in this job.
Like I have pain in where my leg used to be, and it's called phantom pain. And it's just the nerves, like they don't really know the leg's gone.
For older children like Colin who have intermittent pain, self-hypnosis enables them to re-engage in their normal activity.
I can now make the pain go using the switches by myself, and I just do the same thing with my hands and like talking my mind to myself. This is how I help myself go in my trance. Put your fingers like this and put your thumbs around like this and just stare at your fingers, and then they'll close together like that. When they close together, you close your eyes. Before I got cancer, I skied, cross-country skied quite a bit. And when I came in and my leg was amputated and everything, I didn't think I was going to be able to ski again. So, and just 2 weeks ago, I went up to the mountain where we skied and tried to ski. It was kind of hard, but I made around a 1 kilometer loop. It was kind of tiring.
Do you remember when
There are many variations on how to use hypnosis for controlling pain and anxiety. One that works particularly well for Pamela and her mother is the magic glove.
And when she puts the magic glove on, I think that she can actually visualize that her hand is being encompassed in this glove. And although if the vein Christine doesn't work and they have to find a new vein, she does go ouch and owie. She doesn't get all upset and agitated and throw the whole thing away. It does work. She does not feel the pain the same way that she did originally before we used that glove procedure. It really has made a big difference. It really works. It's terrific. I'm just so glad that I know that I can do this with her. But I did find that I have to be aware in myself that it is going to work. If I were to approach it thinking, oh, this isn't going to work, it's just dumb, then it won't work. I think I have to approach it with the attitude, this is going to work, and I get right in it with her. What are we going to do today when we have our vein Christine? Do you want to use the magic glove, or do you want to tell your vein to stand up the way you do sometimes at home?
The glove.
You can use that hand.
This is the one.
All right.
Pamela, put up your little hand. Now I've got my glove. Okay, here's the glove. Here's one. You got it? Okay, now I'm going to put it on right there. Here's your little finger. There. On there. There. It's on there. Are you watching? How about this finger? It's kind of hard to get in the glove sometimes. I think this has been a process, and we've evolved to this point. We weren't always as calm as we were today. Lovely. That glove is so nice. It makes all the pain go away, that magic glove. Well, distraction is terrific. If you can focus your mind off of the pain that's going on around you onto something else. I do that myself, and I thought, gee, it's terrific. Pamela now can do that too with us, and we do it together. We just make up our minds we're not going to pay any attention to what's being done, and we start with whatever book that Pamela chooses, and we just get right into the story. That cat again. Do you see him in the toilet?
The mouse is again.
Where's the mouse? Where? Oh, there they are. I know when we first did procedures, it seemed to go on forever and ever and ever. But now, the length of time that an LP takes just seems like a blink of an eye.
Using a doctor's kit as a creative tool for preparing a younger child like Adam for a procedure.
Put your hand out.
All right.
I'm getting this up.
I see. Right there?
It hurts.
It hurts?
Hurts for a minute.
It hurts for only a minute, right? That's it. My goodness sakes.
No more today.
No more today. That's it.
Another hypnotic technique is the pain switch, an imaginary switch with which Adam can learn to turn down pain in various parts of his body.
In your brain, there are switches that control how much you feel, so that if you want to feel everything, then you have the switch turned on full. But if you want to know what's happening but not to be bothered by the feeling, then you find the special switch that goes to that hand, close your eyes, and you find it, and it's got a special color, and I don't know what special color Adam's switches are, but you'll find out, because he'll close his eyes and he'll tell you. He must find the switch that goes to his hand and turn it down, because when he turns it down, he's not bothered by the feeling nearly as much, and it's quite exciting. Leslie knows about this, right? Leslie could teach Adam, because she uses it. Which hand would you like to turn down the switch to?
This one.
This one? Wonderful. Okay. Now, you close your eyes. Have you found the switch to your hand? Okay, good. Now, Leslie is going to turn down the switch. You turn down the switch to this hand, see? And this hand, the switch is on full. Okay, and I'm going to test with something a little sharper. Can you feel everything there, Les?
Yeah.
That's 10, okay? Doesn't feel that great, does it? No, because it's a little sharp. But you tell me when I touch the other hand, this one that you've turned down, how much that feels like.
See, that doesn't hurt.
2.
2. Does that hurt at all, Leslie?
No.
Very good.
After watching Leslie's pain switch, Adam feels much calmer.
Did that hurt your hand very much? No, good. You learn to relax your hand and your fingers. Remember? We're going to learn more of that at home.
Adam's progress was evident in the spinal tap that followed.
Lovely book, isn't it? Hey?
This is my finger, okay? Nothing else, just my finger.
And there's the wee teddy bear. Okay, pretty soon your bag's going to go to sleep.
With the psychological techniques, we found, of course, that the people who are doing the procedures, after an initial period, have had a much better time. Nobody likes doing painful procedures to children who are crying. But secondly, and I think perhaps more importantly, the feeling of pride and accomplishment that the children and the parents both get, and well deserve, in doing this sort of thing, in helping their children and themselves to get through all these painful procedures that are so necessary, but nobody likes. And psychological treatments and methods have been very effective in our hands.
Leslie and her mom, Anne, have a smorgasbord of coping techniques they draw on, both hypnotic and behavioral. For her IV, she chooses blowing.
That was really relaxed and
Very good. A
just
heavy
falling
rock.
asleep. Yeah.
The parent is the expert on how the child handles things, and mostly the staff listens, and that's great because they're part of the team too. What I try to do is focus on exactly what is happening to her, because I know that's where her focus is. So it's almost like sending my energy to the child. You know, like the sort of the power going, you know, positive vibes. Let's do this together. Let's really concentrate, do what we've learned to do, and if we do it properly, things will go smoothly and we'll be out of here in no time. So when I'm coaching her, I'm really not aware of anything else happening around us. I mean, the building could fall down and I wouldn't know. So that's part of it, that focus, and I think she feels that. It's kind of an intense relationship. Sometimes during the procedures, you feel almost like a wave coming over you, and you think, I'm going to lose the concentration and start thinking about how I'm feeling, and you really can't do that. And what I used to say to myself, if this little kid can handle it, then surely I can handle it for a few more minutes.
Okay, we'll do a practice right now. Okay, and what I'm going to do is I'm going to count, and if you want to, you can keep your eyes open or you can close them. And closing them helps to concentrate and helps you to be able to see things quite clearly. Okay? So I'll just count to 5, and then there'll be a surprise. Okay? 1. In preparing for a bone marrow, the key to Leslie's success is her willingness to practice. 4 and 5. And now here we are in a very favorite room in your house at home. And I'm not sure what room this is, but you know it very, very, very well. What room is it?
The family room.
It's the family room. Lovely. And where are we sitting?
On the couch.
We're sitting on the couch. Is there anybody else here with us?
Yeah.
Who?
My mom.
Now, as I stroke your back, can you feel the difference? Can you feel your back feeling rested and relaxed?
Yes.
Excellent. Okay, so all that I will have to do during The procedure is rub this hand and remind you that we're transferring it to your back, okay? Allow the sleepiness to come into your back.
Let's hear this. Now.
For the potentially more painful bone marrow aspiration, Leslie draws on all of her techniques, particularly the hypnotic ones.
And as I stroke your hand, your back feels more and more comfortable. Can you feel that beginning?
Mm-hmm.
Excellent. And the pushing has stopped now. Okay.
Can see out the window on the trampoline.
Ah, and who's jumping on the trampoline?
My brother and his friends.
Oh, they're goofing around, aren't they?
It's like a game plan the day before the big game. And then when we get there, I become the coach. I try to retreat into the background and not really suffocate her with attention, because she knows what her role is and I've got my role.
Now I want you to find your black switch. Have you found it?
Mm-hmm.
Okay. What are you going to turn your black switch down today, Les?
2.
After watching how to use the magic switch, Anne was ready to use it with Leslie during her cranial tap.
Good girl. A few more blows. Slow ones to relax. Very good. Okay.
Leslie's pain and anxiety is clearly reduced by the hypnotic trance.
There is a lot of support to ease the children's experiences.
The courage and gutsiness of our children and their parents is a continual source of inspiration for us in cancer treatment.
Right a bit more. I'm at work, Daddy.
Yeah, I'm at work, Daddy.
I'm at a hospital getting
I'm
treatment.
at hospital getting treatment.
To make me all well.
Oh, well. Thank you. There you are.
Thank you very much.
I love you.
I love you too.
Bye-bye.
Bye-bye.
Night-night.
Night-night.